Core Physicians' provider culture is based off of three principal values: integrity and compassion as the basis for positive human relationships, respect both for the individual and the team, and creativity and optimism. Our most powerful asset is our people. So the delivery of primary care is at the heart of what we do. We, as leadership team, really worked as servant leaders for the mission of the organization and the mission of primary care, which is really to excel and enhance the health of our community. We do this in typical ways where we support CME, continuing medical education for our providers, but we do it in some ways that I think are not traditional and not something that you commonly find in other organizations. In each of our primary care practices, we've designated physicians as site leaders. In addition, primary care has a medical director. All of these physician leaders have been given the opportunity to participate in additional training that is not common to most of your medical school training. One of the ways that we've done that is by the development of a program with the University of New Hampshire that fills in some gaps that traditional medical school training doesn't allow for. Some of it is along the financial line, some of it is along the strategic line, some of it is just building a team and a healthy culture. So our physician site leads and our medical directors here have had the opportunity to go through that program. In addition, we have offered them the opportunity to go through Lean Daily Management System Training Program. That's a program internal to our organization that really is there to teach them the skill set of how do you look at your practice and understand when there's an opportunity for improvement. And then once you've recognized it, how do you go through the actual process improvement steps? Not just going through the steps, but really in a way to produce something that's sustainably improved from where you started. And you don't end there. It's incremental improvement from there each time they're out. So our physician site leads with their practice administrator dyads form a team at the very local unit. These local unit leaders then participate in a primary care steering council that the primary care medical director and primary care director lead. Leadership finds this committee to be so important for the evolution of primary care. Not only do the leaders of primary care participate in that steering committee, but myself as the chief medical officer and Sean O'Neill as the chief operations officer join that meeting regularly. We're really there not to impose our views, but to make sure that any barriers to providing the necessary care or improvement are eliminated as best as possible for them so that they can continue to do what only they can do. The boots on the ground who are doing the day in and day out work know what it is that they need to thrive, what their patients need to thrive, and we're there to help them do it. Core Physicians enjoys a really strong relationship with the community. Most of our providers live immediately in this community, and it's easy for them to want to see their way to engaging with the community, engaging with its patients, engaging with its schools, with our community nursing facilities, and we do this in a variety of ways. Some of it is in formal leadership positions that our providers hold at these institutions. Other ways are through education forums. We participate in a lot of community events. We participate in local community news by delivering educational articles to patients. And I think really the connection that we're able to form with the community ends up being reflected in our ability to grow. And what we've seen year over year is that we continue to increase in our number of patients that are coming to us looking for us to be able to deliver their primary care. And more patients are becoming accustomed to their primary care being associated with Core Physicians, associated with Exeter Health Resources. The confidence the community has in us is what has continued to allow us to grow. And as we continue to grow, we're able to evolve in the number of offerings that we can bring to our patients. So it's really been a win-win. My vision for primary care is, yes, it's to be recognized as an efficient, high quality, innovative, compassionate primary care. But beyond that, what I want to be able to say to folks is in a heartbeat, I would send any family member to any one of these primary care teams. And I can say that right now, I do. My children are cared for by CORE. Myself, I'm cared for by CORE. And I think that's really a testament to your providers and your team to say that you would send anybody in your family to any one of these members in a heartbeat. It's the highest compliment. If you're somebody who loves primary care and you want to be part of a team that loves primary care and you thrive in a creative environment, an innovative environment, one that strives to be the best that they can be, I'd say give us a call.